Delivering care safely and efficiently means coordinating many people, often working in different departments and locations around the hospital. When we update patient records on paper, they become disorganized over time. They may not be immediately available when needed and are difficult to share with colleagues. It can also make clinical decisions slower and more difficult, and could affect patient safety if complete records are not readily available. Patients face longer waiting times and the frustration of repeating information they've already provided. TrakCare will change all of this. Using electronic records, it will deliver up-to-date patient information and treatment choices instantly to everyone who needs them. Clinicians can then make faster, more informed decisions, and patients will enjoy a much better and safer experience. A patient journey can have many stages and routes. Each examination, test, referral, prescription and treatment generates vital information. TrakCare creates a single electronic store of that information, so it can be retrieved and updated instantly at any time. When TrakCare is up and running, a patient arriving at the emergency department will be triaged and information will be accessed to determine the most appropriate care pathway. The information collected electronically is then added to TrakCare at each stage of their treatment journey. This could be referral to a specialist department, admission, or discharge following assessment and treatment. If multidisciplinary teams need to make decisions about the care needed, they can access patient records from different locations. They decide the most effective treatment quickly and efficiently, with everyone looking at the same information without needing to be in the same place at the same time. If the patient is admitted to a ward or emergency assessment unit, all further treatments and observations are added to the centralised record. All staff have relevant up-to-date information to prioritise consultations and determine how patients need to be monitored. And when the patient is ready to go home, TrakCare generates a summary of the care and treatment provided, enabling the clinician to discharge the patient safely and swiftly. It also sends information to their GP. The patient may later return as an inpatient, outpatient, or as an emergency attendee. The electronic records will be instantly available, showing the assessments carried out, diagnoses, treatments and medications. There's less chance of vital information being overlooked, and decisions about further treatment will be quicker and more effective. When TrakCare is operational, you'll be managing information digitally rather than on paper. We'll all have a single and constantly updated picture of how we're caring for each patient. TrakCare isn't an IT system. It is a journey to change the way we all work, so we can deliver better patient outcomes more safely and efficiently. It will affect all of us, no matter what role we play. It is our solution, driven locally, and designed by healthcare professionals to meet real needs and deliver real benefits to you and your patients. TrakCare will start going live in November. Initially, we'll be focusing on emergency, maternity and patient administration systems. Pharmacy stock will then be added in early 2016. Phase 2 includes theatres, electronic prescribing, medicines administration and further clinical noting. Once this information is brought together, TrakCare will offer clinical decision support and vital signs recording. Every member of staff, no matter what your role, needs to be TrakCare ready. So get involved in training, engagement and demo sessions, and make TrakCare part of your team meetings. This will ensure that the system delivers real benefits to you, your colleagues and your patients. The team would really like to hear from you with any issues, concerns and ideas. So get in touch using the contact details shown.